My name is Mira. I'm an emergency medicine pharmacist in Los Angeles. I support Bernie Sanders because his Medicare for All plan is what the American healthcare system needs to stop hurting patients. Our current for profit model leads to many of our people becoming sicker, disabled, or dying as a result of lack of access to care. Many more face financial ruin as a direct result of seeking care. And none of us are guaranteed protection from the cruelties of our current healthcare system, regardless of whether we have insurance or not. This healthcare model is our greatest national embarrassment and a great moral failure. We are the richest country in the world. We currently pay double for healthcare compared to other developed nations. Yet, for that, we're the only country where tens of thousands of people die each year because they can't get access to care, and hundreds of thousands go bankrupt as a result of pursuing care. The US is literally the only developed country where going bankrupt over medical care is a thing that happens. We allow insurance companies, pharmaceutical companies, medical manufacturers, and other conglomerates to profiteer, making billions every year off the backs of patients and society as a whole. Pharmaceutical companies have been allowed to monopolize the market and gouge us for drugs that we may have paid to develop in the first place. Old medicines that used to be dirt cheap get their rights purchased by a single manufacturer, who then overnight is allowed to jack up the price to whatever it sees fit. The cost implications of this have been astronomical. We know that when this happens, drug utilization decreases, meaning fewer patients receive the drug. Talk about rationing. Our current for-profit model has also been a major cause for severe, widespread drug shortages of critical medications. Thanks to manufacturer consolidation, an ever-increasing greed for higher and higher profits, the U.S. has experienced something that was previously unimaginable: rationing of basic life-saving medicines, things like IV fluids, epinephrine, sodium bicarbonate, among many others. Healthcare providers have had to scramble to figure out how to deal with these critical shortages and minimize the impact on patient care. We have had to use alternatives that may be inferior, may result in more side effects, or may be more costly. And unfortunately, sometimes there just aren't appropriate alternatives available. Unsurprisingly, when shortages resolve and drugs do come back on the market, it is with a hefty markup in price that we have no option but to pay. We must put an end to the unscrupulous price gouging of pharma and insurance companies that leads to rationing of care in our current system. We must put an end to the needless pain, suffering, and death that this current for-profit model causes to patients and society as a whole. Bernie Sanders is the only presidential candidate who offers a realistic, substantive approach to reforming our broken healthcare system with his Medicare for All plan. This is why I stand firmly behind Bernie, and I am committed to fight alongside him now and beyond November to help enact this legislation and help mend our broken healthcare system. And I hope that you will join us as well.